Finally, Adam Vaughan from The New Scientist.
Hi, you said you're recruiting 18,000 contact tracers. I wanted to ask, how many do you have today? What date will you hit 18,000? And how important are those tracers as a strategy for controlling the virus after the lockdown? And secondly, we heard today that the NHS contact tracing app will be ready within 3 weeks. What's your goal for the number of people you want to download it, and how will you incentivize them to do so?
I knew we'd get some tough questions from The New Scientist. The answer to your questions are as soon as possible and as many as possible. But I know that's not exactly a numerical answer. We're recruiting the contact tracers. I'm sorry I don't have the information to hand as to exactly how many we've recruited, but that is underway. We hope to have the contact tracers who will help when we find a positive test to work out who they've been in contact with and make sure they do the appropriate thing. We hope to have the contact tracers in place before or at the same time as the app goes live. And you're right on the app. We're expecting that to be ready by the middle of May. And both of these things together, because they work together along with the testing, and they'll help us to keep the level of new cases down once we've used social distancing measures to get those new cases down. And that's the best thing for health, and it's the best thing for the economy. That's it's work in progress. I appreciate that I haven't, other than saying the middle of May, I haven't given you numerical details. I don't have the data to hand, but I'll try to find that for you. And then on the how many people, the more people who download the app and keep their Bluetooth on, the more effective the app is going to be. So there is no answer other than as many as possible. Because if everybody downloads it, it will just be more effective at spotting who people have been in contact with through contact tracing, and helping alongside the human contact tracing for people to be able to keep the R down by catching those who they may have transmitted the disease to. It's also, of course, tied with the rules around isolation. Because what really also matters is if you have been in substantial contact with somebody who's tested positive, making sure we get the right rules around what that person is then required and asked to do is also a critical part of this infrastructure that we're building.
Can I just ask a follow-up question? From what you've just said, it's that you said that the human contact tracers and the app will work in tandem. And you're saying if the app is coming in 3 weeks, does that mean the target for the 18,000 is in 3 weeks?
Before or at the same time as the app.
So yes.
Yeah.
Okay.
Good stuff. Thank you very much indeed. Great to have The New Scientist at the Downing Street briefing. I hope my answer was scientifically valid. Thank you very much for joining us, and no doubt see you again soon.